I was really excited that as an organization that has been working for 26 years with promotores and community health workers, many of our goals were met. We had 3 topics. One of them is diversity in the workforce. When we say diversity, it meant more integrating community health workers and promotoras into public health careers. It's getting them involved in some of those gaps that we see when it comes to health disparities.
It's always an incredible experience to work with Dia La Mujer. The conference is fabulous to see how thirsty they are for knowledge and knowing that they want that knowledge to bring it back to their community for the good of everyone there, and it's being done in a way that's both linguistically and culturally appropriate for the communities they serve.
The other one was related to providing the vaccine equity that we all deserve. There are children that are not getting their vaccinations. Some of them are poor and they don't know that they have these resources available to them.
First, we're here to celebrate Community Health Worker Day. And the second is to talk about how community health workers can expand their role and how they can advocate for things like vaccine equity and inclusion in clinical trials. We want this to be a continued conversation. And so I think from what I've seen, the community health workers are excited to do that. They're excited to move forward.
To see so many people come together and try to help the community and the various places where they live, I thought it was just, it was phenomenal. To go back and what they've imparted to me to impart into the others, not only for the community health workers, but even my family, my church.
We know that 2% Latino participation and 8% African American participation in clinical trials is wrong. We have medications that need to be applied for all of our population. And then when you only have certain people that are participating in clinical trials, there's a problem there.
It's hard work. So when you have a networking environment like we do today and getting information from this place and putting it all together, it makes it easier for CHWs and it makes it easier for everyone else that we serve. I've never done anything to the point where I even asked the representative and the senator to just hear us out.
I was excited about their excitement, listening to them, how it was the first time meeting their state legislator. And that was a first for almost all of the people that were there, all of promotoras. And just the understanding that they have a voice and that they are key opinion leaders. So besides celebrating the governor's proclamation for April 14th as Community Health Worker Day in Texas, we also received a State of Texas Senate Resolution number 41. And I was so excited to receive that because it commemorates the work of community health workers and promotoras as dedicated caregivers. We also had the recognition of our Senator Cesar Blanco from El Paso, and another dear friend of ours, of our organization, and many of our community health workers was Denise Smith. She is the executive director and founder of the National Association of Community Health Workers. You know, one of the things that we loved is the camaraderie that we saw. We had 42 counties represented at our conference, and many of these community health workers traveled 12 hours to get to Austin.
Every time I come, I've learned so much. I've known Venus for a long, long time, and she's been very helpful to our program up in the DFW area. But I will say, you all are keeping us up to date on different changes and different things that are happening in healthcare. Currently, I work in healthcare, training community health workers for different companies, so I want to know as much as possible on what are the changes and that things are going on.